Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, a case of hematuria has come to you. Then what do you do? In a case of hematuria, first the best initial investigation which is done for a case of hematuria is actually an ultrasonography is done. Once you have done an ultrasonography, you can do urine microscopic examination. Okay, on urine microscopic examination, you will be sure whether hematuria is present or not will be found out by urine microscopic examination. Then you can do x-ray, kidney, urinary bladder x-ray is done. This will tell us whether there is a stone. For renal stone, we can do this investigation. Then, if you can do DTPA will help us to estimate. It will help us to estimate the glomerular filtration rate. So these are the things which you can do for hematuria.
thank you and thank you for watching.